Good morning, everyone. I'm Ruth Rai, and my presentation is on topic Pediatric Thalassemia, Child Health Nursing. Firstly, the contents are given on the screen. Number one, we have introduction, then definition, causes, types of thalassemia, signs and symptoms, complications, preventions, diagnostic findings, medical managements, nursing intervention, and lastly, we have conclusion. Now we move to introduction. Thalassemia is a complex disease that children inherit from their parents. It's a blood disease that can cause anemia, a lack of sufficient red blood cells, among many other symptoms, which means if a parents are suffering from thalassemia, then it is likely for their children to have the same disease. It's a blood disease that can cause anemia and other symptoms too. After this, we have definition. Basically, in thalassemia, there is an imbalance in proteins that usually from hemoglobin, which is the element in blood that makes it red and allows it to transform oxygen throughout the body. Because of these problems, the red blood cells are abnormal. They are pale instead of rich red in color and they don't function properly. Which means when there is imbalance in proteins that form hemoglobin, then it causes thalassemia. To understand thalassemia, first of all, we must have to know about hemoglobin. Hemoglobin is the pigment which gives red color to the blood and helps the blood to transform oxygen throughout the body. Because of these imbalance, the red blood cells are abnormal. They are pale yellowish instead of rich red color, and they also don't function properly. Then we have causes. What causes thalassemia? Thalassemia is caused by mutation in the DNA of cells that makes hemoglobin, the substance in red blood cells that carries oxygen throughout your body. The mutation associated with thalassemia are passed from parents to children. This means a thalassemia is caused when changes in the DNA cells takes place, cells which makes hemoglobin. These mutations or changes in DNA cells are passed from parents to children. Next paragraph. Hemoglobin molecules are made of chains called alpha and beta chains that can be affected by mutation. In thalassemia, the production of either the alpha or beta chains are reduced, resulting in either alpha thalassemia or beta thalassemia. Which means hemoglobin is made of chains, alpha chains and beta chains that can be affected by mutation. If the production of either alpha or beta chains are reduced, then it results to either alpha thalassemia or beta thalassemia. Now we come to types of thalassemia. We already know the types of thalassemia. One is alpha thalassemia and the other is beta thalassemia. First is alpha thalassemia. Four genes are involved in making the alpha hemoglobin chain. You get two from each of your parents. That means the child will receive two genes from their mother and two genes from their father, total four genes. If you inherit one mutated gene, you will have no signs or symptoms of thalassemia, but you are a carrier of disease and can pass it on to your children. Two mutated gene, your thalassemia signs and symptoms will be mild. This condition might be called alpha thalassemia trait. Q mutated gene, your signs and symptoms will be moderate to severe. This means if a child inherits one mutated gene, then the signs and symptoms will not be seen. But still, the child can carry thalassemia and pass it on to his own children. And if the child inherits two mutated gene, then a mild signs and symptoms of thalassemia will be seen. This condition might be called alpha thalassemia trait. When there is question what is alpha thalassemia trait, then the answer will be the child inheriting two mutated gene. Lastly, if a child inherits Q mutated gene, the signs and symptoms will be moderate to severe. Last paragraph, inheriting four mutated genes is rare and usually results in stillbirth. Babies born with this condition often die shortly after birth or require lifelong transfusion therapy. In rare cases, a child born with condition can be treated with transfusions and a stem cells transplant. That means it is rare for a child to inherit all the four mutated genes, But still, if a child inherits all the four mutated genes, then the child will die shortly after the birth or will require lifelong transfusion therapy. Child born with such rare cases can be treated with transfusion and a stem cell transplant. Number 2 is beta thalassemia. So, two genes are involved in making the beta hemoglobin chain. You get one from each of your parents. That means the child inherits one gene from their mother and one gene from their father. Total two genes. If you inherit one mutated gene, you'll have mild signs and symptoms. This condition is called thalassemia minor or beta thalassemia. Two mutated genes, your signs and symptoms will be moderate to severe. This condition is called thalassemia major or Cooley anemia. That means if a child inherits one mutated gene, then he will have mild signs and symptoms. This thalassemia is called as thalassemia minor or beta thalassemia. But if a child inherits two mutated genes, then the signs and symptoms will be moderate to severe. This condition is called as major thalassemia, thalassemia major, or chylomicronemia. I hope all of you know what anemia is. It is a lack of sufficient red blood cells. Babies born with two defective beta hemoglobin genes usually are healthy at birth but develop signs and symptoms within the first 2 years of life. A milder form called thalassemia intermedia also can result from two mutated genes. That means when a baby is born with two defective beta hemoglobin genes, usually they are healthy at birth. But within the first 2 years of life, it develops signs and symptoms. Thalassemia intermedia, which is a middle form of thalassemia, can also result from the two mutated genes. Next, we have signs and symptoms. So, what are the signs and symptoms of thalassemia? Patients with less severe types of the disorder might not develop any symptoms. Patients with more severe types of the thalassemia can have number 1, slight to extremely pale skin, that is yellowish skin, slight jaundice, or swollen or large abdomen. Number 2, they will have very prominent face bones. Number 3, stunted growth. Stunted growth is growing slowly than normal age. Number 4, we have nerve problems or paralysis. That means the child having severe thalassemia might show the symptoms of nerve problems or paralysis. Number 5 is exercise tolerance. And number 6 is heart murmur or abnormal sound of the heart. After that, we have complications. So, what are the complications during thalassemia? First, let us know what are the possible complications of moderate to severe thalassemia. They include number 1, iron overload. People with thalassemia can get much iron in their bodies, either from the disease or from frequent blood transfusions. Too much iron can result in damage to your heart, liver, and endocrine system, which includes hormone producing glands that regulate processes throughout your body. That means when a person suffers from thalassemia, then his or her body may contain more amount of iron than required. It may be either because of the disease or because of frequent blood transfusion. Too much iron in the body may cause or may damage the patient's heart, liver, and endocrine system, including hormone producing glands. Number 2, infection. People with thalassemia have an increased risk of infection. This is especially true if you have had your spleen removed. That means if a person has removed his or her spleen, then the chance of infection is more, as the patient of thalassemia themselves has the chance or the risk of getting infection. Another is complication that occurs in cases of severe thalassemia. Number 1 is bone deformities. So, what are bone deformities? Thalassemia can make your bone marrow expand, which causes your bone to widen. This can result in abnormal bone structure, especially in your face and skull. Bone marrow expansion also makes bones thin and brittle, increasing the chance of broken bones. That means when a person suffers from severe thalassemia, then the person's or the patient's bone marrow expands, which causes bones to widen. It may cause to the structure of bones to be abnormal, especially in face and skull. When a bone marrow expands, then it may cause the bones to get thin and brittle, which increase the chance of bones to break down. Number two is enlarged spleen. So what is spleen or the function of spleen? The spleen helps your body fight against the infection and filter unwanted material, such as old or damaged blood cells. A thalassemia is mostly caused by the destruction of large number of red blood cells, which causes your spleen to enlarge and work harder than normal. Number three is slowed growth rates. Anemia can both slow a child's growth and delay puberty. That means when a person suffers from thalassemia, at that time the person's symptoms of anemia can slow down the growth of child and also delay puberty, that is your youthful age. Number four is heart problems. Congestive heart failure and abnormal heart rhythms can be associated with severe thalassemia. That means a person suffering from thalassemia may have frequent heart failure and abnormal heart rhythms. After that, we come to prevention. How are thalassemia prevented? In most cases, you can't prevent thalassemia. If you have thalassemia or if you carry a thalassemia gene, consider talking with a genetic counselor or guidance if you want to have children. Which means thalassemia cannot be prevented in most cases, but if you carry a thalassemia gene and want to have a baby, then you can go and talk with a genetic counselor for guidance. Second paragraph says there is a form of assisted reproductive technology diagnosis which screens an embryo in its early stages for genetic mutation combined with in vitro fertilization. This might help parents who have thalassemia or who are carriers of defective hemoglobin gene have healthy babies. That means there is a reproductive technology diagnosis which helps to show an embryo in its early stages for genetic mutation, which is combined with vitro fertilization. This technology diagnosis may help the parents who carries thalassemia or the defective hemoglobin gene to have a healthy babies. So, this reproductive technology diagnosis or procedure involves retrieving mature eggs and fertilizing them with sperm in a dish in the laboratory. Then the embryos are tested for the defective genes, and only those without genetic defects are implanted into the uterus. After this, we have diagnostic findings. Laboratory and imaging studies in thalassemia include the following. Number one is CBC count and peripheral blood smear. The CBC count and peripheral blood film examination results are usually sufficient to suspect the diagnosis. Number two is iron studies. Serum level is elevated with saturation reaching as high as 80%. The serum ferritin level, which is frequently used to monitor the status of iron overload, is also elevated. Number three is skeletal survey. Skeletal survey and other imaging studies reveal classic changes of the bones that are usually encountered in patients who are not regularly transfused. Number four is ECG. ECG and echocardiography are performed to monitor cardiac functions. Number five is HLA typing. HLA typing is performed for patients for whom bone marrow transplantation is considered. After that, we have medical management. The objectives of supportive therapy is to maintain sufficient hemoglobin levels to prevent tissue hypoxia. Number one is supportive therapy. The objective of supportive therapy is to maintain sufficient hemoglobin levels to prevent tissue hypoxia. Number two is splenectomy. Splenectomy is the principal surgical procedure used for many patients with thalassemia. Number three is transfusions. Transfusions are the foundation of medical management. Recent studies have evaluated the benefits of maintaining the child's hemoglobin level above 10 gram per deciliter. A transfusion is required every 2 to 4 weeks. Number 4 is bone marrow transplantation. Bone marrow transplantation offers the possibility to cure some children with thalassemia, either using marrow from an unaffected sibling or a matched unrelated donor. Number 5 is diet. A normal diet is recommended with emphasis on the following supplements: folic acid, small doses of ascorbic acid, that is vitamin C, and alpha tocopherol, that is vitamin E. Iron should not be given, and the foods rich in iron should be avoided. After that is nursing intervention. Nursing intervention for a child with thalassemia are: number 1 is activity. Assist the client in planning and prioritizing activities of daily living ADL. Assist the client in developing a schedule for daily activity and rest, and stress the importance of frequent rest periods. Number 2 is health education. Explain the importance of the diagnostic procedures such as complete blood count, bone marrow aspiration, and a possible referral to the hematologist, and also explain the hematological vocabulary and the function of blood elements such as white blood cells, red blood cells, and platelets. Number 3 is prevent infection. Nurses should assess local or systemic signs of infection, such as fever, chills, swelling, pain, and body malaise. Instruct the client to avoid contact with people with existing infection. Instruct the client to avoid raw fruits and vegetables and uncooked meat. Stress the importance of daily hygiene, mouth care, and perineal care. And also teach the client and visitors the proper hand washing. Number 4 is prevent bleeding. Nurses should assess any frank bleeding from nose, gums, vagina, or urinary or gastrointestinal tract, and also monitor platelet count. So, in conclusion, I'd like to say that this presentation on topic thalassemia in child is very helpful for us as it gives us the better knowledge in understanding the disease, which impairs the quality of life of children significantly. We also know the major factors affecting the quality of life that are related to better control of iron overload, prevention, medical management, nursing intervention, etc. It provides us the knowledge to prevent thalassemia in children. Thank you for your cooperation.